Hi everyone, I'm Bonita and welcome back to my channel about arachnoiditis and the disability and symptoms that it causes in our everyday lives. I'm sorry that I've neglected you for a while. I have been busy trying to wrap up my work career. I've had a goal for probably the last year to stop working. This injury happened to me 2 years ago, and I call it an injury because it was inflicted by a physician. And if you followed my story, you do understand that it happened from an epidural, my first epidural ever for a herniated disc. And I had to have a blood patch immediately. And I've had symptoms ever since, including I had to have an ER visit not even 2 weeks after the injection because I was still having symptoms of a spinal fluid leak. So I have battled this now for 2 years, almost 2.5. I've gone through 4 pairs of glasses. This is my fourth pair in that amount of time trying to be able to see. I did have a 20-minute time frame that I actually went blind before I went to the ER. I would get up in the morning, things would be okay. Then I'd sit down and immediately my vision would start going. I think just the pressure on my lower back would cause my vision problems. And the doctors and specialists that I've seen don't really seem to understand that there are vision problems related to a spinal puncture. But there is. I can tell you there absolutely is. That has been one of my biggest fears over the last 2 years, is that I was going to go blind. I am still driving. I got this last pair of glasses about a month ago. I can see better in them than I have out of all of the other ones that I had. But I wonder if maybe my vision is stabilizing a bit. I can't guarantee that because, like I said, about every 6 months, I have to get another pair of glasses to adjust to whatever's going on with my eyes from this. But it made it very difficult for me to work. It made it difficult for me to watch television. It made it difficult for me to read my phone messages. All of that was very difficult. And over the last year, my goal was to stop working. I have been in tremendous pain trying to do my job. My job required me to go upstairs at apartments, go downstairs, carry a computer. I did get a pull bag, but when you're going to people's homes, it's just as painful to try to pull a heavy bag up and down stairs. So I would try to limit what I would carry. But I noticed over that time that basically if I carried anything in any arm, it was going to cause me pain probably within 10 to 12 steps. So even sitting at my desk sometimes can be painful. Standing to wash dishes can be painful. All of those things, I have to take frequent breaks. But at my job, I wasn't allowed to. In fact, I had to miss lunch breaks. I had to miss any breaks. We were never allowed them. And so many times I would work 9 hours straight without a break, and I would be in so much pain. It was hard for me to even walk to my car. I chose to not go the disability route at this point. I've been saving money. I've been living frugally to try to retire early. And I've been doing this for a lot of years, but I really stepped up my game in the last 2 years so that I could stop working. I'm only 57. I'll be 58 in January. Nothing against disability. It was just a personal choice for me that I was not going to apply at this time, and I was going to try to ride it out on my savings. Now, if you're on a fixed income or you're on disability, I do have another channel that is all about frugal living, depression era living, saving money, cutting expenses, and it is called Pennies to Dollars. If you're interested in following me there to see if you can help your household at all with the frugal living added to your fixed income. I wanted to answer some questions today that I have been asked a lot. what medicines am I on right now? I am currently on amitriptyline 10 milligrams at bedtime. Now, this is something that was added to me by one of the neurologists here probably 6 months ago. And I feel like that has helped me more in being able to sleep better than anything else so far. I was in so much pain at night. I couldn't keep a position. I would wake up about every 15 minutes in pain, not know if I could roll over, sit up, or do anything like that. So this amitriptyline is given for chronic pain, and it's given at bedtime, and it has helped me a lot. I was getting this refilled through my neurologist, and he said, "You know what? Your doctor can take this prescription over. There's nothing really more I can do for you. So just go to your primary doctor and ask them if they'll start prescribing it." I went to my doctor and she said, "Absolutely, I could have gave that to you to begin with." Well, I don't know why she didn't. I'd never heard of it before. It's been life-changing. I'm on a very small dose. They told me that I could increase that if needed, but it will cause like dry mouth and dry eyes. So I'm just getting by right now with it because it's better than it was, and we'll take anything that's better than it was, right? I'm also on tizanidine. It is a muscle relaxer that my arthritis doctor actually prescribed for me. I had been to several doctors. No one would help me with any kind of pain relief. And I went to him because I was having spasms, cramps, joint pain, and he put me on a low dose of a muscle relaxer. I came home and took one pill. This is how much pain that I had been in. I took one pill and I felt normal for 24 hours. I could take a walk. I could do things. For 24 hours, I felt like I was normal before the spinal puncture. And I thought my whole world had changed. Well, I am allowed up to 3 a day. I normally only take about one, and I take it at bedtime. That is because they do make me sleepy, and I want to be able to stay awake during the day to do things. So I don't want to take 3 a day if I can help it, but I am allowed to take up to 3 a day if I need to. I do still have involuntary movements. That's probably the biggest pain when it comes to sleeping at night because my toes will move, my legs, I can feel the muscles or the nerves jerking in my legs. It's primarily my left leg, which was the one that was immediately affected when I had the spinal puncture. And then the last one that I'm on is diclofenac. That is an anti-inflammatory that I can take 3 times a day, and I generally do take that 3 times a day. It's supposed to be safer than ibuprofen. I can't really tell that it helps a whole lot, but if I forget a pill, I know that it's helping some because it does make a difference. And then I still take arthritis medicine, just Tylenol over the counter. So overall, I've seen like 2 neurologists, 2 pain doctors, a nerve specialist. So overall, I think I've seen like 5 specialists. I guess I've just decided I am done with that. I feel like I've given it a good try. I've been to all of these other physicians. My doctor can take over the muscle relaxer and the amitriptyline. I don't feel like there's anything more they can do for me. They flat told me there's nothing more they can do but treat my symptoms. So I'm just going to live my life to the best that I can. I'm going to do things. I'm going to continue to do things I've always done and just take breaks if I need to. I have to do that now. So, I'll wash dishes, I'll take a break. I'll do a YouTube video, I'll take a break. I'll hang clothes on the line, I take a break. So those are the things that I do to try to control the symptoms the best that I can. I have shown you before in the description box some of the things I use for pain, including the acupressure pillow, the muscle massager. I do always travel with that acupressure pillow. And I use it a lot when I'm in pain, so I don't have to pull over. I'll just keep repositioning it behind my back, and it keeps me from having to pull over so much. I do still like to vacation. We do that. I'm enjoying my time at home. I'm enjoying not having to get up at a certain time and be somewhere at a certain time to do my job when I feel like I just need to lay in bed a little bit longer. The stress has decreased tremendously just by leaving my job. I feel like that has helped my condition more than anything, because now I'm allowed to take breaks and I'm allowed to do things to meet my physical abilities that day. And that is just huge for me. It's life changing. So when they say that if you're under stress or you have anxiety or you have a job that you don't like or any of those things, that it really affects your health, I really feel like it has in this situation. I feel like just leaving my job was totally the right decision for me. So I hope you've enjoyed this video. If you have any comments or questions, please list them below, and I hope to see you next time.